Okay, we're
Hello
on.
everybody, it's Thursday again, it's 2:30 and we are the infant feeding team at the John Radcliffe Hospital in Oxford, and we have got our infant feeding session for about an hour again on any questions that you've got that you want answers for, any worries that you've got, anything that is niggling you, or any problems you're having with your babies or before you've had your babies, to do with breastfeeding or feeding your baby in any way, and how your baby's behaving. So we're really happy here to answer anything you've got worries about. We're back in one of the side rooms on level 5 again today. We walk around the ward wherever we can find somewhere in the hospital that we can secrete our way around and get internet. So fingers crossed that we won't be crossed off again or cut off again. We were a couple of times last week. But hopefully you're still enjoying the sessions. We've had lots of feedback from midwives and mums on the wards telling us that they've had some really positive comments from people watching. So I'm hoping that you're all finding it helpful, and if you're not, tell us why you're not so we can make it even better. And whatever we can help you with, let us help you. I'm Naomi Morton, and this is...
I'm Alex Mulford, and we're 2 of the 5 of the infant feeding team here at the John Radcliffe. So I've got my laptop poised, ready for questions, which we haven't had any as yet. And I can see there's a number of you watching. It'd be lovely if you could just tell us you can hear us and that you can see us, because we really aren't, as anyone who's seen it before, we're not really technical at all.
We're good at breastfeeding. That's not on the computer.
Yeah, and yes, we do fumble around on this a bit, I'm afraid. So it would be lovely if someone just puts a thumbs up to say you can hear us. It would be handy. Thanks very much. So,
it's been a great tool that we've got on our in our repertoire now, and we found it actually is reaching lots of people. And I think that can only be absolutely fantastic that we've been able to keep in touch with people and support people with anything they're worried about in this way, and hopefully we'll keep doing that in the next months ahead. So fingers crossed that you'll keep seeing us and you'll keep asking us questions.
So I'm going to say thank you to Lydia, Jenny and Lauren for all saying thank you for telling us they can hear us. So I got a nice thumbs up from Lauren, and we can hear and see you from Lydia and Jenny. Thank you, you 3. That's very helpful. So we were going to talk about Baby Friendly today, weren't we? So, which maybe some of you know about. Unicef Baby Friendly, well, everybody knows Unicef, the charity, and it's the charity for obviously in support of children. And actually it's very active here in the UK. The Baby Friendly initiative is a UK-wide initiative that, in fact, it's international, but the branch that we're involved in is UK-wide, and it looks at practices within hospitals to ensure that we give the best care we can to support parents in their choices of feeding and in those early days. And hospitals and community centres like health visitors and things can all be accredited, and we're working towards accreditation. So we are in stage 2 of 3 stages and going for stage 3 hopefully in the autumn, and that's where the BFI assessors will come and have a chat with the mums, maybe you, and have a chat with you and say, did you know some of the key information that you needed to know to make informed decisions about feeding, and that we gave you the support to help you with feeding, and that we gave you the information of where to get support afterwards once your baby was born if you were having any problems. So this is an ongoing process. We've been in this journey for a number of years now. Last time then they came a couple of years ago, they came and interviewed our staff, and the staff had to answer questions about how to support parents with positioning and attachment, to ensure that they were able to give really good information about feeding choices and how to help parents make an informed decision about how they were going to feed their baby and what babies are like in the first few days. And we've talked about it on these sessions lots about what is normal baby behaviour. So this is what Baby Friendly is about, and it's some of you, as you're pregnant now, some of you that are listening, you may well be the ones that are contacted in October by Unicef and asked about what did we tell you. So so we're working towards that at the moment. We thought we'd mention it. Got anything to add to that?
Well, just to say that in Scotland 100% of the hospitals are baby friendly, or working towards them if they haven't actually maintained or got the status, and in the UK it's about 60 or 70% now. So we're lagging a little bit behind Scotland, but we're moving up into it, and I think that there's tiny small hospitals. The community units in Oxfordshire got baby-friendly status 20 years ago, and so they've been working in that practice of breastfeeding for a long time. So some of you may have had more information about baby-friendly in the areas that you are, Wallingford or Chipping Norton, where they have been baby-friendly for a long time. And Oxford, which has got a lot more deliveries than the small midwife-led units have, we've got a lot more things to deal with and a lot more staff to do lots of training with. So you know, it's a 7-year journey that we have planned, and I think we're about 5 years into it, 5.5 years into it now. So we are ahead of the schedule, because you know, everybody is working together, and you know, mums are doing really well. And I would like to think that some of you may have had babies a few years ago, and then have come back and had babies in the last year or so and seen a change, and it would be quite nice to give us feedback on that, what you found, if anything's changed in the care that you've received between maybe first or second babies to the next baby you've had, or if anything's different, just to see if it is making an impact in the fact that we're doing a lot more rigorous training.
Yeah.
So and you do get that information in your pregnancy, the opportunity to discuss having breast milk, giving your baby breast milk, and what it does for you and your baby if you give it, and the things that your baby will benefit from if it gets breast milk as its first source of food. And that's exclusive breastfeeding in the first 6 months of its life, and then you start to wean your baby after 6 months, and that means not giving things like pacifiers and bottle feeding your baby, or giving formula to your baby in that time. But actually, the reality is that most mothers supplement their babies with express breast milk, and like to give a bottle so that they can feel that they've got a little bit more control over their lives if they're struggling with a baby that's always breastfeeding and they don't feel they can go out. So, you know, giving your baby breast milk is exclusive. You are exclusively feeding your baby if it just gets breast milk. But it, you know, one of the things that we talk about is not introducing things like bottles and dummies in the first few weeks of your baby's life, because that can affect the way that your baby sees the way breast milk is delivered. So it's just making you understand the principles of what we're doing and the theories behind it, which means that we encourage mums and families to exclusively breastfeed their baby and to give their baby and the mum the absolute chance to feed their babies at the breast well, and that's what it's about.
And I think, you know, we're also aware that we live in a world where it doesn't always go quite how we hope, and that many, you know, there are mothers out there that will need to give other milk, or they may have chosen to give formula milk right from the start. With the mothers that have hoped to breastfeed and end up giving some formula milk, we will always maximise the milk that they give of their own. So we're here to support parents in whatever feeding decision they make. And we know that in Oxfordshire, 81% of women actually choose, their intention is to breastfeed. So we're here to support them in that decision and try and hope that they can achieve that goal that they're aiming for, which is what Unicef Baby Friendly is working towards, helping parents, not telling parents what to do, but to help parents to achieve the goals that they've set themselves. And that's where we and all our staff, through the Unicef training, are skilled in helping parents to do that. So all our staff have got really good training with day-to-day support, helping parents get those first absolutely crucial feeds sorted, and then helping parents maximise their milk supplies. We've talked a lot about how important it is to have a milk supply, because if you've got a milk supply, you've then got choices going forwards. But I was thinking about that. A lot of the information is available in a really small booklet that we have. What did we do with it, Naomi? Is it around? It's a booklet that we give out to you. Sorry, that's something whipping my head back.
Back to front, but it's the Off to the Best Start.
So this booklet is it's very simple. It's got a lot of pictures, but actually the information in it is absolutely fantastic. It talks about why you would choose to breastfeed, why women do. So we're talking about the fact that it's geared up to protect mothers from things like some forms of cancer, osteoporosis, heart disease and diabetes, and that it also, for babies that are getting breast milk, there's much less chance of them having gastrointestinal problems, ear infections, diabetes, ear infections, urinary tract infections, and some forms of childhood cancer. So there are, it's all in there. It's very simply put in this booklet. This booklet is available online, and you can find it at Baby Friendly, so the Unicef Baby Friendly website. There's loads of really good information on there. I know we've talked about it on these sessions before. There's some fantastic information on there, and they also do a guide to bottle feeding as well, which is really useful.
And also it's got all the things that you need to know about being baby friendly, and that's not just the UNICEF thing, but actually being friendly to your baby and giving your baby lots of benefits. And breastfeeding grows your baby's brain. It allows you to respond to your baby in a much more human way, in the fact that you follow instincts and your baby asks when it wants to be fed, and you're not on a sort of a schedule so much, and that the baby, when your breasts are full, you wake your baby up, and when your baby's hungry, it wakes you up. And so it's responding, it's reciprocal, and it's not what we used to call demand feeding, it's more responsive. So you and your baby are responding to each other rather than your baby demanding milk from you, which is kind of sounds a bit more austere than responsiveness.
It's a two-way process, isn't it?
Totally.
So they're a dyad, they're two people together and they work together. So it's a much more two-way process. Emmy's put a question up. Hi ladies, hope we're well. Thank you, we are. So just to clarify, not to give dummies if you're wanting to breastfeed. We certainly do suggest that you don't introduce dummies early on. Babies have to learn how to breastfeed. Breastfeeding is a learned skill, and the more practice that mummy and baby have with feeding, the better it's going to go. So if you start putting a dummy in, babies don't necessarily come and ask for feeds because they're getting their sucking needs met, and they don't browse for feeds, and they don't have those opportunities to practice. And we do know that sometimes it can inhibit the baby to actually ask for food when it's really hungry, and it can impact on weight gain in some babies, not all, but some babies. So certainly initially we would suggest that you try and stay clear from dummies if at all possible.
6 weeks, isn't it?
So thanks for the question, Emmy. But then anybody else got anything? Because it's very slow on the start today. So thinking about
answered all your questions.
Yeah, that would be great. So we've answered everything. So this booklet, as we mentioned, is really good. It's got a whole step-by-step process about how a baby attaches, which we've talked about on these sessions quite a lot in the past. It's got a really good section on hand expressing as well. And you will get a paper copy when you've had your baby. We hand them out postnatally. But by all means, go and have a look. If you're in the antenatal stages, go and have a look and have a look at it. It is a really simple but very, very good resource and covers everything, including having details about which support organisations there are for you as well.
It talks about how to know if your baby's feeding well, and we also talk about that a lot, and we do this every week so that people that haven't perhaps heard one of these sessions don't have to go back. I mean, this is our 15th session, I think, since lockdown, and so they are all on a YouTube session, on the YouTube channel, the Oxfordshire Maternal Voices Partnership YouTube channel. So you can look back on the ones that we've already done if you want to sit and watch hours and hours of questions and answers on breastfeeding. But we have said a lot of the things over and over, which is not a bad thing. But it's recognising that your baby is getting enough food, and I think that's one of the things that most parents worry about, and one of the things that we get more problems with is that babies aren't reaching their milestones in weight in the early days, and mums aren't producing quite enough milk, or the babies aren't waking up for the feeds. And it's, there's no one size fits all. Your baby is individual to you and your breasts are individual to you. So it's about recognising the basic things and how your baby is behaving. So if your baby is alert and handles well, that's very important, that you can tell if your baby doesn't seem to be well. And I think as parents you spend a lot of time at the doctors in the first few months, or ringing the doctors, not quite sure whether your baby's all right or not because they can't tell you. So it's about looking at the way your baby handles, the colour of their skin, how they feel. It's unusual for a baby to have a temperature in the first 3 months of life, so it's about being in tune with your baby, and skin to skin cools your baby as much as it warms your baby. So that's a very comforting way to manage your baby when when you're not sure if they've got a snuffle or something. But it's unusual for a baby to have a temperature. But always check with a thermometer if you're not sure. You can feel the back of their necks, and that will tell you how they feel, if they feel a bit warm or not.
Much better than their extremities, because their extremities, their hands and feet, aren't a good indication of what temperature they are. We've got questions coming through, by the way.
So, it's about looking at how they behave, and then you're looking at how they're suckling and swallowing. Are they waking up for feeds? Are they having 8 to 12 feeds in 24 hours, 8 to 13 feeds sometimes? They do feed sort of 2 to 3 hourly, and sometimes 1 to 2 hourly in a cluster, and then they have a longer sleep. And are they transferring the milk? So can you hear them swallowing and glugging? That's the first really good sign to know if they're getting milk. And are they weeing enough? So lots of heavy wet nappies. Once the milk's come in the early days they won't do very many wees, but they should be doing some. And by day 5 you should find that they have about 6 wet nappies. And if you're not sure if they are, put 2 tablespoons of water in a nappy and feel how heavy it is, because that's about what they should be doing each wee. And then are they pooing, and what colour is the poo? And in this booklet that we've got, this one that we're talking about, they've got
page 17. It's the most important page in the whole book.
You've got a poo chart. And it tells you that the poo changes colour for the first 5 days, and it should stay a nice yellow colour after you get to day 5 or 6. You should find that your baby's poos are yellow. They shouldn't be going green very often. Occasionally they will, but normally they should be yellow, and 2 a day. And then the last one is they should be gaining 20 to 30 grams a day until they're about 4 months old. They poo every day, twice a day at minimum. That's the minimum amount, £2 coin size, until they're about 5 or 6 weeks old, and then they get less frequent, their poos. Some will do the same number and keep going, but if they don't, we don't worry so much. But they should poo every day until they're about 5 or 6 weeks old.
So I've got some questions coming through. Sophie said, is breastfeeding still possible after a C-section under GA? Can there be any difficulties with it? Well, mums might be a bit groggy if they've had a GA. It doesn't stop them breastfeeding though, and very often what will happen is that they may not even be aware they have breastfed. They've probably been spoken to. The midwife or maternity support workers help them put the baby to the breast, normally in a side-lying position, so there's no risk of the mum having to hold the baby, but she actually sadly might not remember, even though the baby is fed. And it's quite often in those instances we have that conversation, and the partner will say, oh yes, you did breastfeed, but the mother doesn't remember because she's a bit groggy afterwards. So yes, perfectly feasible to feed afterwards. There's no reason why you can't feed straight after a general anaesthetic exception. Yes, just the sad thing, maybe get your partner, if you know you're going to have one, get your partner to take a picture so that they can show you that you did feed your baby, because you might not remember it. So yes, perfectly feasible, no reason why not.
Do as much skin to skin as you can, safely, if you're very dozy. And the staff on the observation ward will help you do that. If you've been transferred around there, they will help you to support your baby and to initiate a good feed, or to do some hand expressing to get some colostrum out. And you may have collection of colostrum that you've brought in with you at this point as well, which is good.
Yeah, and if you know you're going to have a GA section, maybe doing some antenatal expressing before you have your baby might be an idea, so that you have got a little something to give the baby. So have a think about that and maybe give us a call. Christina said hello, and she has to bottle feed for medical reasons, and I understand this might not be the best option. What's your advice? Well, there are occasions where breastfeeding is not right for mother or baby, so we would suggest that you do as much skin to skin contact. Give those, it's certainly the first feed in skin to skin contact. It's just as important to have it in skin to skin, whether it's a breastfeed or a bottle feed. So we talk about responsive bottle feeding, so having babies in close so they don't miss out on that interaction, that eye-to-eye contact, that you follow the baby's cues and you keep it as loving as you can, and your baby will be fine. So we just, by all means, if there's any concerns, Christina, then give us a call so we can talk about it and see what's happening. But it's a case of making sure you do it, keep your baby close, lots of skin to skin, being responsive, not expecting babies to take a particular volume, letting them tell you when they're hungry, and just making it as natural and intuitive as possible. Have I missed anything?
No, I don't think so. I think, just be confident that you're going to be a wonderful mum. Irrespective of the way that you're feeding your baby.
Absolutely.
Just don't feel that you've not done anything right, because you've done everything right, and you will continue to do that. But if you want to talk us through it and anything else, you know, we can check all the drugs you're on as well, double check, and we can, you know, do a plan for you.
Yeah, absolutely. Aya's put a question out. My baby's 1 month old and still feeds about 16 times a day, down from 24, so that's an improvement. And it's led to me having overproduction issues, meaning that I'm uncomfortable and leaking everywhere all the time. But also he chokes when I get a letdown. Hang on, I've got this bit more. And often takes in a lot of air. He's fine on weight gain and nappies are generally good, but I do worry about the choking and gulping air and would love to feed a little less, especially since I'm back working already from home. I wonder if a bit of support might be handy for you, Aya. I wonder if we could help with positioning and attachment, because babies that maybe don't get quite the mouthful can show all of these signs, because they're not getting that fattier milk that tells them they're full, so they just keep coming back to the breast.
And gain loads of weight and poo wee lots and lots, and everyone says it's all fine, but they're unhappy and you're unhappy, and that's really important. So
we could do an attend anywhere call over the phone. We can watch positioning attachment that way, Aya, so maybe give us a call, because your baby's now 1 month old, so you won't be under the community midwives anymore, but we'd be more than happy to have a chat with you and maybe do an attend anywhere call and have a look and see if there's anything we can do to help you with that.
I think the contact details are put onto the feed at the end of the session so that you can contact us. There's also the Oxfordshire Breastfeeding Support Services and La Leche League and the Baby Cafe in Abingdon, and they all do Zoom consultations as well. So there's lots of support without having clinics and drop-ins. You can still contact lots of people, so do use them and use us.
So Aya's had another bit on. She said sometimes he's not hungry, he's using the breast to comfort himself, because he'll feed every half hour and then throw up. The breast is there for comfort, that's the first thing I will say, but from what you're saying, I think that this might be a case where your baby's getting a lot of that watery, very important vitamin rich first part of the milk and maybe not getting the fattier part, and the fattier part's what tells your baby they're full, and that's why they keep coming back and they do end up being sick. It'd be interesting to know what colour your nappies are. They may be green, and that would be an indicator that's what's going on. But it's quite probably something to do with just how the baby's coming to the breast, and we may be able to help you with that, so let us know. So as at the moment there's no more questions, we're up to date. So
how are you all doing with your storage of breast milk? We could talk about that again, and hand expression and pumping and things. Find out, you know, pumping, is everyone finding that, you know, if you're triple feeding and you're giving your baby extra because you're struggling with weight gain and things, it can be quite difficult to do that. And just to make sure that you do it all correctly, make sure, you know, that you've got the right information on pumping and maximising your milk. There's a really good video that you can watch actually with pumping to increase milk supply, and it's called Hands-on Pumping, Stanford University, Maximising Your Milk Supply, and it won't do anyone any harm to watch it. It's a 9-minute video clip on Google, and we encourage mums that are starting to pump to have a little look at that so that they can learn how to maximise their milk supply. And also Kelly Mom is a very good website, at Kelly Mom, M-O-M, an American website which is also very supportive in increasing milk supply. Completely the opposite to what we were just talking about, but equally distressing if babies haven't quite got enough milk to you know, get you over the first few weeks. And so triple feeding is where you breastfeed your baby and you do compressions and switches. So we talked about that a little bit before, where you swap your baby from one side to the other, and compressing is squeezing milk into your baby's mouth while it's suckling to increase the suckling, and that can be like pumping when your baby is feeding. And then you have to top your baby up with express milk, and then the next thing is you have to pump, and it's a cycle that you have to keep doing for a good couple of weeks in order to increase your milk supply if your baby's not quite getting enough milk. So it is very, very frustrating and very, very hard for mums to do. And I think particularly at this time, mums are feeling very isolated because they're not actually talking to other mums in the same way, and not meeting other mums that are doing the same as you, and that makes you feel very isolated and feeling that you can't cope with doing it. But actually, you know, if you do 8 pumps in 24 hours, it doesn't have to be 3 hourly, it's just 8 pumps in 24 hours, the price of breasts, you will up your prolactin levels, and normally you can kickstart your supply again and start to increase the amount of milk that you get. It might be that you just need to do switches and compressions as the first stage. If you think your baby's not quite getting enough and it's a bit sleepy, when your baby falls asleep at the breast in the suckling, take him or her off and put her on the other side, and then compress your breast to give her a bit of a hit, and then when she goes to sleep again, swap back to that side and do as many rounds as you can for about 48 hours. That is often enough to just wake them up and teach them how to increase the flow of the milk, and they keep feeding more. And what you find after about 48 hours is that your baby will start to suckle for longer before he falls asleep, and that's what you see start to happen. Yeah. And then you start to switch less, and then your baby gets cross when you try and change them because they're actually getting milk from that breast, and then you find that you're going back to normal breastfeeding without having to switch and compress. But it's a great tool to have at home without any other equipment.
Yeah, absolutely.
And it is very, very effective, and it can put baby's weight up quite a lot, quite significantly. And you can just do that yourself for about 48 hours. I think the thing with breast milk is it takes 48 hours to change, and that's what people find so difficult with pumping and trying to increase their milk supplies. They don't see anything for a few days, and that means that you're more inclined to give up because you're not getting what you want. But actually, suddenly you get payback, and certainly if you do triple feeding for a couple of weeks, you will start to see your supply going up, and you will start to be able to then reduce the number of top-ups and then reduce the amount of pumping, and then just go to breastfeeding.
That's what we're always aiming for, isn't it?
Yeah.
So even though when we do are helping parents when they're struggling to get their supply up, the intention is never that it's long-term pumping. The intention is always to get the baby back to the breast. Yeah. So we don't envisage mums having to sit there pumping in the long term.
You've got to see the end of the tunnel when you're in that. You're in that process. It just can't go on forever and ever and ever. So you've got to have a real quick fix on that one. But you have to do it. You have to pump 8 times a day, because if you don't, it does go on for weeks and weeks and weeks, as mums will vouch for, that it dribbles on. So you have to just find the time, even when you're exhausted and you haven't got anything left in you. You just have to do it, put your head down and do it, and suddenly you get payback, and then you've got a milk supply.
This isn't for everyone, obviously. This is for the ones that are struggling to get their supply up. And the time that you can get your supply up the most is in those first few days. So it's for those that haven't had their babies yet, thinking about in those first few days really working on your supply. If your baby's really not waking very much for feeds, and if they're healthy in turn, they might not. But then actually a bit of hand expressing will always put a bit in the bank for you. So you'll have a bit that you can give if you want to, but you're also telling the body you want more milk. So it never goes amiss in that respect. I came back and said that mostly the poos are yellow, with a few with green stripes, slightly greeny streaks. So it might still be worth having a quick chat though. If they've been solidly green, I think that we may have been on the right lines, but we still probably can improve things. Harriet has said she's not sure if we've mentioned at the beginning where to get the leaflet from. You can get the leaflet from Unicef Baby Friendly online. You can also get it from our maternity infant feeding pages as well, because it should be up there too, and you will be handed a copy once you've had your baby.
Excuse me.
Bless you. So right, Suzanne.
And Start for Life is also the website you can get it from. But your midwife can give you a tiny little version of one as well in the antenatal period. Some the community midwives can have little tiny ones that just open up, and they've just got the basics on them with information for you to find. But it's after you've had your baby that you get given it.
And Suzanne said, following Aya's question, what's the average amount of feeds a baby needs? I feed my 2-month-old quite regularly, around 12 times a day. Is that too often? No, not too often. Anywhere between 8 and 13 is considered completely normal. And if you went to other parts of the world and you said to a woman, women who tend to carry their babies in front of them in slings, etc., and you said to them, how often do you feed your baby? They wouldn't have a clue, because that baby will be on, off, on, off, on, off. Remember, it's way more than just food. It's loads more than food.
And Amy Brown talks about this. She says if you ask women in Africa how many times they feed their baby at night, they say, I haven't got a clue. And you ask a lady in the Western world how many times they feed their baby, and they'll tell you every time they wake up and how many times they fed, because it's just not normal in their life to be disturbed at night. But actually, other cultures, it's just normal around the clock, and babies will just feed,
You're sneezing,
and they don't know. They have no idea when their baby's fed and when they didn't. So
Excuse me, I need a glass of water. Susan said that she has similar problems with regard to the oversupply, so it's well worth getting some help. I'm just going to nip and have a glass of water. So, if you want to carry on talking, I'll be back in 2 seconds.
It's about increasing, did you say increasing the supply? I didn't quite hear that, Alex, what the question was.
Similar problem to Aya.
Too much milk, so an oversupply. So it is about increasing the amount of good removal of milk that you're looking at. So when you're looking at your positioning and attachment, you've got to really, really make sure that your baby is not central here, and it gets more difficult. If I do that there away from my silhouette, you can see. So they're not central, they're asymmetrical, and that's quite a subtle difference that you can see, that the baby's chin is right underneath the breast here, so that they're taking milk out. And if you have a shallower latch, so it's central, and a lot of people will automatically put their baby in that position because it's the bottle feeding method. You know, you're putting a bottle in a baby's mouth because that's all you know as a person that hasn't breastfed before. But actually, a breastfeed is very asymmetrical, and the nipple should just skim over the baby's gum when you're feeding. So
do you find a picture?
Yeah, you find a picture for it, so that they can really get underneath the breast with the chin and the jaw muscles and the gum, and just retrieve the milk from deep within the breast. And by doing that, then they get the right mix of milk. And I think that's the most important thing, and it's the most common thing, is that babies overstimulate the milk because they're not on a deep enough latch, and it's millimeters. Just improving that latch, just, you know, maybe just move your baby down a little bit round, so that
Coming back your way.
when you have got your baby here, it might be that he's too far up, so you might want to bring him right a bit further down. You can't always see what I'm doing here, but you can see here that the baby is much lower than here. So you might find that your baby's body is further away from you. If you tuck your baby close in and bring him up from underneath, then he's going to get his nose at the nipple, and his chin will hit the breast first, so the chin is underneath the breast, and his head will go back and he'll sniff the air. And by doing that, they line themselves up to go on the breast in a different way to if they're across you like that. You see, there's much more space. So if you're holding your baby like this, and you're putting your baby on the breast like this, you're more likely to look like you're giving your baby a bottle than if you move your hands round and you put your baby from underneath. I think you've got some pictures there, haven't you, Alex?
Yeah, we're just going to get these ones. Because these are better ones.
Yeah, so that you really manage to get a really asymmetrical latch. It's really important that it's asymmetrical, it's not symmetrical.
So this is a baby going nose to nipple. That baby's head's now tipped back. So you can see the nipple is right at the top of the mouth, and the lower lip is as far away from the base of the mouth, base of the nipple as possible. Right,
it's a long
nose
way
is
from the breast.
tipped out, and then we've got it on this one as well. And you can see the nipples right at the top of the mouth, and the lower lip is as far away from the base as possible. The upper lip is just going to skim that nipple, just going right in the top. And when the baby is on, that's what it looks like. This is what Naomi's talking about, sniffing the air. The chin is right in, and the nose is free.
You feel like the baby's going to fall off your breast almost. It's not going to go on.
And what mothers can see is that they can see they've got more areola visible, so that's the darker area around the nipple, more areola visible above the upper lip than they can see down below the chin. So this tells you it's an asymmetrical attachment, and that's because when the baby goes on in their mouth, they've got, if this is the mouth with the lower lip and upper lip, the nipple goes in at the top, and it goes right to the back of the mouth, and it's got to go in over the tongue, which is sitting here. So it's got to go in here, otherwise it hits the tongue and it gets jammed between a rasping palate, so a hard palate, and a rasping tongue, which is why mums get sore. And if you think about the breast tissue all around here is where the milk's coming from, they're not going to get the milk. So if it goes on like that, they've got much more in their mouths to milk. That's what we're looking at.
So by doing that, you will remove milk more effectively, and it dampens down the supply.
and millimetres make a difference, and that's why it's well worth it having a chat perhaps and having a quick look on one of our Attend Anywhere, which is our Zoom type calls, because we actually might be able to just move the way you're bringing your baby to the breast just a tiny bit, and it may make a really big difference. And the same for you, Suzanne, if they're having similar problems. Millimetres make a really, really big difference for a baby with positioning and attachment.
But do talk to us if you're still struggling. Have a conversation with us one-to-one so we can make it more personal to you, and just to discuss your individual problems on this forum. But if you've got any other issues, we can talk you through those.
Yeah. Well, we haven't got any more questions at the moment.
Haven't got any more questions?
I know, it's rare. Last week we were chock-a-block with questions.
They came flying in, didn't they?
Yeah, they did. We were chock-a-block. So
we could talk a bit more about baby friendly, could we?
Yeah.
Is there anything more you can say? What was the chart that you had that we're putting up? Is that
the stage chart?
Yeah.
It's just here.
You talked about that, didn't you?
Yeah. So we were talking about how there are 3 stages to being accredited. So this is what we work to. So in the first instance, it was the hospital agreed to go for it, and there had to be a written policy saying what we were going to do, and the hospital, including Bruno Hothoff, who's our CEO, the head of the hospital, had to sign to commit to doing it. And in stage 2, we educated the workforce. Now, lots of our staff were already really well educated, but we just made sure everybody was working to the same level. So all members of staff are able to teach positioning and attachment, hand expressing, talk about informed choice about feeding, and support mothers with whatever feeding method they're doing. But also, it's making sure that parents are aware about being responsive to their babies, that you can't spoil their babies, that cuddling is a really good thing, that babies haven't got the capacity to manipulate you. You can't spoil them. So it's just responding to the needs of your baby, and that's how you'll have a happier baby. So that's all part of it.
And the health visitors are baby friendly accredited as well. So Oxfordshire health visitors are also baby friendly already, and they have achieved that several years ago now. And if you're lucky enough to have a children's centre in your area, then the children's centres are also baby friendly. But also the neonatal unit is just working towards the end of their baby friendly status as well. So they are also working within the same model. So it's inside out and outside in. So hopefully at some point you will not get conflicting advice. That's the whole point, is that everybody says the same, so that you feel that you're not confused too much about the advice that you get. Obviously, on day 0, somebody will say, oh, your baby doesn't need to feed as many times as 8 a day in the first day 0. And then somebody will say, but your baby needs to feed a little bit more often today, and it should be peeing more. And then the next day they'll say, yes, but your baby will be doing this many feeds today. And then by day 5 they'll say, well, yes, your baby needs to be feeding 8 times in 24 hours, and they should be doing this much wee, and your baby should be weighed. And so it's not surprising that you get confused, because each day, certainly for the first couple of weeks of your baby's life, you will get somebody saying something different about the way your baby's behaving. You have not quite enough milk because the colostral phase is on, and your baby's chomping for milk, and they'll be saying, well, keep feeding, and your baby should be feeding frequently. And then suddenly you get loads and loads of milk, and your baby's gorging on it and not waking up very much, and they say, well, yeah, but you need to feed your baby a little bit more frequently than that. And then somebody will say, but then you need to do something else and you don't need to wake your baby up to feed it if the weight gain is enough. And so you suddenly think, well, what am I supposed to do? Because somebody's told me something different every visit. Quite rightly, mostly, because actually that your needs are changing every day, and you don't realise how subtle it is. But actually, as a mother, if you look back to what you were doing, if your baby's say 3 or 4 weeks old, look back to what you were doing at 2 weeks, and then look back to what you were doing at 5 days, and look back to what you were doing at your day your baby was born, and how you feel about your experience, and what your baby's doing, and how you handled your baby, and how you felt about being parents. You're experts by 4 weeks. You're throwing your baby about, and you're going out and feeding it, and most people are getting on and not so worried about dropping their babies in the same way as they were on day 0. So think back about where you were and where you are now, and how you've come along as parents, to pat yourself on the back and say, actually, yeah, you're right. I have done really well.
It's a really steep learning curve. But we're here to support you. That's the thing to get across, is that we're here to support you. And the whole thing about the conflicting advice is, as Naomi mentions, things do change day by day with babies. So whilst 0.2 of a mil of colostrum is absolutely fine on day 0 to day 1, it is not fine on day 3. So, that's the point to take in, that babies actually change very rapidly once they're born. Their stomachs grow from the size of a cherry to the size of a walnut by day 3, the size of an apricot by the end of the first week, and an egg by the end of sort of 2 to 3 weeks. So, we're talking about an increasing stomach, therefore the milk supply matches it too.
So upping those volumes from when you go home. So they may say just a little bit in hospital, but you have to act on it as parents when you get home, because nobody else is there to tell you to do it until the midwife comes back. So it's important that you look and say, well, what's my baby doing? Is he suckling and swallowing? Is he peeing? What are his poos like? Has he pooed for the last day 2, day 3? And if not, then you need to be talking to someone or increasing the volumes.
Yeah.
So
breastfed babies don't get constipated, or just get that out there, because people seem to think that they do. They don't. If they're not pooing, they're not getting enough food, so they need a bit more.
And so if you need to increase your milk and you're not sure that your baby can do that, then you need to start pumping. You don't need to be told to do that. You can start pumping if you've got a pump, and you can ring somebody up and talk to them. But don't not do anything, because then you end up with a baby that's lost a lot of weight, and then you have to come back and have lots of support from us, which means that you don't have pajama days anymore. You're out and about visiting us.
We don't make them wear clothes, though, Naomi. They can stay in their pyjamas here. We're quite happy, and you get fed.
But you're exhausted because you're backwards and forwards, having lots of weight checks. So, be really proactive as parents. You can't overfeed a breastfed baby, so, give it lots of breast milk if that's what you, give as much as you can. But always talk to somebody if you're not sure. Don't sit and say, oh, well, I'll see how it goes tonight. Ring us up and talk to someone.
Yeah.
Really
Alice has come through with a question. So she says her baby is 4 weeks old now. In fact, today, 4 weeks today. Happy 4-week day. And she's just had her tongue tie clipped on Monday. She struggles to open her mouth wide to breastfeed, just sucks the end of the nipple. Even though the tongue tie has been divided, she's still feeding the same. Having the same issues with her gulping and struggling with the flow, getting lots of wind and is very uncomfortable. Tried lots of different positions but struggling to get a good latch. I'm going to hand over to Naomi on that one.
So, have you got her in exactly the right position? What is your positioning and attachment like? I think a lot of people have a huge expectation on a tongue tie that it's a magic wand, and a lot of people have their baby's tongue tie snipped and it doesn't feel any different.
Yeah.
What was the positioning like before? Was it really good? If it wasn't quite brilliant before, you might have room for improvement still, and that might be the issue, that your baby's not being offered the breast in the right way, so they're not gaping. So certainly if you nudge the nipple down the top of the baby's lip, that often elicits a gape. And if you put your baby in the right position on the breast, so the nose is at the nipple rather than the mouth, trying to put the bottle in the baby's mouth in the way that a lot of parents do, because that's their image. Offer the nose to nipple, chin close to the breast, rub the nipple down the top lip to allow your baby to gape. One of the things that might help as well is if you've got expressed milk, take it in a syringe or a spoon or just in the bottle, and tip it all over your breast when you're trying to encourage him to feed. Because what he'll do, he'll start licking and his tongue will start to come out, and good feeding is good physio. I will say that every day, and I do frequently, that's the only thing that will improve your baby's tongue function is good feeding. And so allowing your baby to have a good feed means that you have to get your positioning and attachment absolutely brilliant, and that's the hard bit. So you don't say where you are, what part of Oxford you're in, obviously, but you might want to talk to us. You might want to have a conversation with us on the phone about it. But have a look at the positioning things that we've done.
I'm just thinking about, remember what we were talking about, upper lip, lower lip. Make sure your baby is coming on in that position, so not this position, because if you just offer the breast there, they don't have to do anything. But if you make them tip their head back, they have to open their mouth, and what we call elicits the gape. So that's really important. And in a way, you're teasing the baby, you're telling them, I want you to feed, and they go, oh, I really want to do it, and they tip their head back and open their mouth.
And certainly if you dribble milk all over your breast and
Alice is in Bloxham.
Okay.
Your neck of the woods.
You've got lovely Chippy as well to help support you if you're really struggling. The other thing you might find is that if you just put your finger slightly behind the nipple and tip it back slightly when you're offering the breast.
Can you use that one
You
that's
might be able
got
to.
slightly
It's a bit
more
darker
obvious?
as well. You tip the nipple back. Can you see that?
Yeah, do it there. I can see it there.
Can you see that? So you're just literally putting your finger or your thumb on the breast and you're just pulling it back slightly, and that much more of the breast is offered to the baby. So you can see underneath, the baby can get more breast underneath. And then then when the baby goes on, you let go and let the baby go on, and that just offers the baby a little bit more. The other thing that you might find with a tongue tie is that you make a bit of a sandwich. Sometimes the babies need a little bit more to hold on to. Sorry, I'm getting into your space.
That's right, I was going to move.
And you might find that you make a little bit of a sandwich with your breast, just to make it a little bit firmer, and get somebody to trickle milk. We're coming up to the weekend soon, so you've hopefully got a partner at home helping you. But trickle lots of milk everywhere. Put a muslin underneath your towel, because you're going to make a mess. And just squirt milk everywhere, because not only does your baby get the opportunity to lick, they get a present and they don't get frustrated, so they don't cry, and then they start to say, oh yes, it's breast, that's where my milk comes from, this is where I have a nice time, and they go back and they don't get breast aversion, they don't get really cross at the breast where they start crying as soon as you put them close to the breast. So always offer your baby food with a reward. If you're struggling to feed, give them presents all the time. And I say this every time, they're like puppies. Give them a doggy biscuit. You know, they do what they're told if you give them a doggy biscuit. So give them lots of milk, lots and lots of milk. And they will then start to lick and start to gape, and they will start to behave normally. And if you offer the baby the breast in the right way, in the right place, then they will open their mouth in the right way. The other thing that we need to say is about the angle of the dangle, which we do frequently, but if your breasts are down there, and you're trying to put your baby on across your tummy, I've got to do this the right way.
Yeah.
If you're trying to put your baby on across your tummy like that, and your nipples down there, they won't be able to get on. So you need to turn your baby round so that they can get on the breast from underneath. So you're looking at the angle of your breast. So if your breasts are up there, your baby's here, and if it's down there, your baby is down there. So have a look at where your breast is lying and see where your baby needs to be in proportion to that. You might find if your breasts are a long way down here, you can roll a muslin up and put it under your breast to support your chest. So you can roll a muslin up halfway up and put it under your breast, and that will support it a little bit more up, and it means you don't have to hold it so much. But you know, talk to us, or call the girls at Chippy and talk to them as well, because they were your midwives, weren't they? So see if you can just get that checked post tongue tie, just to see if you just need to change your technique slightly to give your baby the opportunity to gape.
Yeah, you can get in contact with us by all means. Delana's put a message up saying she's got anemia. Will she need blood when she gives birth? I'm 35 weeks. So I presume that you're already on iron tablets. If there's any concern about your iron levels, then you'll probably be offered Avenifer, and it will be very much a case of hopefully you won't lose much blood. But if you've got real concerns, can I suggest you contact your midwives, or contact on through the Ask the Midwife sessions that Wendy's doing, because that's very much more her ballpark than us, so as we're the infant feeding team. But usually that's well treated, and they'll keep an eye on you, your midwifery team will. Right, that was it. So yes, Alice was saying she's blocked them, so that is that. It's closest to Chippy, but will they still see her at Chippy at 4 weeks then, Naomi?
It depends if you've seen them before. Have a talk with us. You know, let's do your individual case on the phone so that we can suggest anything to help you if you'd like that.
Yeah.
We're here 7 days a week at the moment, so you can call us at weekends as well.
Yeah, and it's very quick to set up a video call if we want to. They're really very useful, actually, the video calls.
Well, I think we're done, aren't we? I think we've had
unless
50 minutes.
So anybody got any other questions for us? So let's pop them through now if you have. But just to say to you, as we've talked about the Unicef Baby Friendly, go and have a look at their website. When you put Unicef up, it'll always come up with the main Unicef website. What you're looking for is the Baby Friendly Initiative. There are loads of really good resources on there, regardless of how you end up feeding. That's something there for everybody. There's lots about being relationship building. There's some really, really lovely videos on there as well that are well worth watching, really informative for both you, your partner, and maybe grandparents to be. So actually, it's really worth having a look at. We also have resources on our webpage, so you can have a look at our webpage. And then some of them are duplicates, but by all means do that. And get in touch with us if you've got any queries or questions. And hopefully some of you will contact us after this, having spoken to the one Aya about her oversupply. It would be great to have a chat with her too. Yeah. Anything else to add, Naomi?
No, I think same time next week, isn't it?
I think so.
Have a good week.
Yeah.
And call us.
I think it's you and me again as well, actually. I think it's the two of us. Anyway, lovely for all the comments and questions.
Yeah,
thank you very much to all
us.
of you. All right. Okay. All the best.